Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health, and today I would like to introduce to you virtual primary care from First Stop Health. Now, virtual primary care has three parts. One, it has virtual urgent care, which is the 24/7 telemedicine that you know and love from First Stop Health today. Plus, it is virtual chronic care for chronic conditions such as diabetes, hypertension, high cholesterol. And then finally, it's virtual preventive care by coordinating screenings and tests. Now, virtual primary care is a fantastic way to engage employees and their family members in their health. In fact, only about a third of plan members have actually seen a primary care physician in the previous 2 years. So it's super hard to go, right? You gotta make an appointment, you gotta drive there, you gotta park, you gotta wait in a waiting room, you've gotta arrange for childcare. It's like a half a day off of work. Whereas if that visit could be done virtually, it's so much easier and dramatically improves access to care. It also allows for much longer visits. You do that whole half day event and it's only like a 7-minute visit. You can have much longer and more frequent visits with virtual primary care. It's also a great way to incorporate your other benefits that First Stop Health will actually custom load into our system so that we can direct your employees to the specific benefit programs that you have, whether it be for diabetes or musculoskeletal issues or mental health or what have you. Now, employees and their family members will be able to schedule an appointment with a primary care physician of their choosing. And we can set it up oftentimes at $0 out-of-pocket costs like we do with many of our plan members today. Now, the screenings can actually be coordinated through the virtual primary care physician, whether it's referring out to a local imaging center for a mammogram or to a gastroenterologist for a colonoscopy or to a local lab to get a person's blood drawn for, let's say, measuring their cholesterol level. First Stop Health can also refer out to imaging for other reasons as well, and can also refer out to specialists like a dermatologist if you actually do need to be seen in person for something like a skin biopsy. So it's a great way to coordinate virtual care and in-person care as well. Now, First Stop Health offers customized communication strategies that we have been perfecting over the past 8 years. They are persona-driven, which means that the messaging that we deliver is customized to the individual. So that the message that we're sending to a 25-year-old man is different than the message that we're sending to a 45-year-old woman, because they're different, and the way that they use healthcare is different. And so our communication reflects that. Now, why would an employer want to put in virtual primary care? It is a fantastic way to strategically address high-cost claimants by preventing and minimizing many of those high-cost claims before they happen. Things like major musculoskeletal surgery like joint replacements or spine surgery, cardiovascular disease, and cancer. Those three diagnostic areas typically make up the high-cost claimants for a group. And through effective virtual primary care, you can identify many of the conditions earlier, treat them earlier, and in many times prevent the personal catastrophe of one of these things happening to your people and your plan. Now, First Stop Health is so confident in virtual primary care that we will actually provide a utilization guarantee where we will put our fees at risk. So, virtual primary care from First Stop Health is whole person care for your employees and their families. And thank you so much for watching.